Hey everyone, in this video I'll be covering important clinical signs and deformities associated with median nerve using a very simple picture mnemonic. We'll go through the image step by step and see how each clue helps us remember a different median nerve sign. So let's get started. So the first thing you'll notice is that this entire picture has a very bright yellow hue. That's because I generally associate the color yellow with nerves. So whenever you see yellow dominating in one of my mnemonics, it should make you think that we're talking about a nerve. Now, right in the middle of this room is a very large yellow carpet. The word median reminds me of the word middle. So the carpet placed right in the middle helps me remember that this is a mnemonic specifically for the median nerve. Middle and yellow carpet for median nerve. The first major clue is the giant religious painting covering the ceiling and the wall. This reminds me of the hand of benediction, also known as the Pope's blessing hand, which is a classic sign of median nerve injury. If you ask the patient to make a fist, the index and the middle fingers fail to flex, producing the characteristic blessing posture. The same Pope painting also reminds me of the Ochsner's clasp test. In this test, the patient is asked to clasp or interlock both hands together. In median nerve palsy, the affected index finger remains relatively straight and does not flex properly. Now let's move to the family sitting in the center of the room. The mother is working on a large ape statue. The ape immediately reminds me of ape thumb deformity. In ape thumb deformity, the thumb lies in the same plane as that of the palm because of the weakness and wasting of the thenar muscles which is supplied by the median nerve. That's why the ape's thumb looks abnormal and the mother is trying to fix it. Notice that she is repairing the thumb using a pen. The pen reminds me of Penn's test, which is used to assess the functioning of the thumb, especially the abductor pollicis brevis, which is supplied by the median nerve. To perform the pen test, the patient's palm is kept facing upwards and the pen is held above the thumb. The patient is then asked to touch the pen with the thumb by abducting it. If the abductor pollicis brevis is weak due to median nerve injury, the patient fails to touch the pen, making the test positive. Beside her, the father looks pleased with her work and is making a perfect OK sign. That's my reminder for OK sign test, also called as the Kilo-Niven sign, which evaluates the anterior interosseous nerve, which is a branch of the median nerve. Now let's move to the right side of the room. There is a child sitting inside a tunnel, and on top of the tunnel is a small car. Car plus tunnel immediately reminds me of carpal tunnel syndrome, which is one of the most important median nerve entrapment neuropathies. Inside the tunnel, the child is praying before he can eat his tin of beans. Tin reminds me of Tinel sign, where tapping over the median nerve at carpal tunnel produces tingling and paresthesia in the nerve distribution. Now look at the child lying on the carpet in front. He's fallen down awkwardly, and that helps me remember Fallon's test. Fallen for Fallon's test. Finally, near the door, there is a large water can. Door plus can reminds me of Durkheim's test or Durkheim's compression test, which is one of the most sensitive clinical tests for carpal tunnel syndrome. So to summarize, yellow color for nerves in general, medial carpet for median nerve, the painting for pointing index, benediction pose, and also the Ochsner clasp sign. The ape statue for ape thumb deformity, pen for pen test, father making an OK sign for OK sign test, car and tunnel for carpal tunnel syndrome signs, the tin for Tinel sign, fallen kid for Fallen's test, door and can for Durkheim's test.